How is psychosomatic disorder diagnosed? Diagnosing a psychosomatic disorder can be a complex process, as it requires healthcare providers to consider both physical and psychological factors contributing to the symptoms. Here are the typical steps involved in diagnosing a psychosomatic disorder. 1. Medical evaluation. The first step is to rule out any underlying medical conditions that could be causing the physical symptoms. This may involve a thorough physical examination and various medical tests, such as blood tests, imaging studies, and other diagnostic procedures. The goal is to ensure that there are no organic or physical explanations for the symptoms. 2. Clinical assessment. Healthcare providers will conduct a comprehensive clinical assessment, which includes taking a detailed medical and psychological history. They will ask about the nature and duration of the symptoms, any stressors or life events, and the impact of the symptoms on daily life and functioning. 3. Diagnostic criteria. To diagnose a psychosomatic disorder, healthcare professionals typically refer to established diagnostic criteria, such as those outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. These criteria help determine whether the individual meets the diagnostic criteria for specific psychosomatic disorders, such as somatic symptom disorder or illness anxiety disorder. 4. Psychological assessment. A mental health assessment is often conducted to evaluate the individual's psychological well-being, including the presence of anxiety, depression, or other mental health conditions. Psychological assessments can help identify any underlying emotional factors contributing to the symptoms. 5. Collaboration. Collaboration between medical and mental health professionals is essential. Multidisciplinary teams may include primary care physicians, psychiatrists, psychologists, and other specialists to provide a comprehensive assessment and treatment plan. 6. Differential diagnosis. It's important to differentiate psychosomatic symptoms from other medical and psychiatric conditions. Symptoms should not be attributed solely to a psychosomatic disorder if there is evidence of an underlying medical condition or other mental health condition. 7. Longitudinal assessment. The diagnosis of a psychosomatic disorder often involves a longitudinal assessment to establish the persistence and severity of the symptoms over time. 8. Patient collaboration. Engaging the individual in the diagnostic process is crucial. They should be encouraged to provide information about their symptoms, life events, and emotional experiences to help with accurate diagnosis and treatment planning. 9. Treatment planning. Once diagnosed, treatment planning can begin. This often involves a combination of medical management for any underlying medical conditions, as well as psychotherapy to address the emotional factors contributing to the symptoms. It's important to note that the diagnostic process for psychosomatic disorders can be challenging, and a careful, patient-centered approach is necessary. Diagnosis is a critical step in managing these disorders effectively and addressing both the physical and emotional aspects of the condition. Treatment should be tailored to the individual's specific needs and circumstances. How are psychosomatic pain and other somatic symptoms treated? The treatment of psychosomatic pain and other somatic symptoms typically involves a multidisciplinary approach that addresses both the physical and psychological aspects of the condition. The specific treatment plan may vary depending on the individual's unique circumstances, but here are some common approaches. 1. Medical evaluation and management. Initial medical evaluation is crucial to rule out underlying medical conditions. If there is an underlying medical condition, it should be treated and managed as appropriate. Pain management techniques, such as medication, physical therapy, or other medical interventions, may be considered for pain relief. 2. Psychotherapy. A. Cognitive behavioral therapy, CBT. CBT is a well-established psychotherapeutic approach for managing psychosomatic symptoms. It helps individuals identify and modify maladaptive thought patterns and behaviors that contribute to their symptoms. B. Mindfulness-based stress reduction, MBSR. MBSR teaches individuals to be more present in the moment, reduce stress, and manage their symptoms through mindfulness practices. C. Psychodynamic therapy. This type of therapy explores underlying emotional conflicts and their impact on physical symptoms. D. Acceptance and commitment therapy, ACT. ACT helps individuals accept their symptoms and develop strategies for living a fulfilling life despite their condition. 3. Stress management. Stress reduction techniques, such as relaxation exercises, deep breathing, progressive muscle relaxation, and biofeedback, can help manage the emotional component of psychosomatic symptoms. 4. Lifestyle modifications. Lifestyle changes, including regular exercise, a balanced diet, and adequate sleep, can improve overall well-being and reduce the impact of symptoms. Avoiding alcohol, nicotine, and other substances that can exacerbate symptoms is important. 5. Medication. Medications may be prescribed to manage symptoms such as anxiety or depression. In some cases, medications may also be used for pain management. 6. Education and self-care. Psychoeducation helps individuals understand the connection between emotions and physical symptoms and empowers them to take an active role in their treatment. Encouraging self-care practices, such as maintaining a healthy lifestyle and seeking social support, is important. 7. Support groups. Support groups can provide individuals with the opportunity to connect with others who have similar experiences and share coping strategies. 8. Alternative and complementary therapies. Some individuals find relief through alternative therapies like acupuncture, yoga, or massage therapy. These approaches can complement traditional treatment methods. 9. Mind-body interventions. Practices like meditation, guided imagery, and relaxation techniques can help individuals manage their symptoms and emotional distress. 10. Regular follow-up. Ongoing follow-up with healthcare providers and mental health professionals is important to monitor progress, adjust treatment plans, and address any changes in symptoms. The treatment of psychosomatic pain and somatic symptoms often requires patience and persistence. It's essential to work closely with healthcare providers and mental health professionals to develop a tailored treatment plan that addresses the individual's specific needs and circumstances. The goal of treatment is to alleviate distress, improve overall well-being, and help individuals manage their symptoms more effectively. How can I prevent psychosomatic disorder? Preventing psychosomatic disorders involves taking steps to maintain both your physical and emotional well-being. While it may not be possible to completely eliminate the risk of developing psychosomatic symptoms, there are several strategies you can implement to reduce your vulnerability. 1. Stress management. Since stress is a major trigger for psychosomatic symptoms, learning effective stress management techniques is crucial. This can include mindfulness meditation, deep breathing exercises, yoga, progressive muscle relaxation, and regular exercise. 2. Healthy lifestyle choices. Maintain a balanced diet to support physical and mental health. Engage in regular physical activity to reduce stress and promote overall well-being. Get adequate sleep to allow your body and mind to recover. Limit or avoid alcohol and substance use, which can exacerbate emotional distress and physical symptoms. 3. Emotional awareness and expression. Develop emotional intelligence to recognize and express your feelings in healthy ways. This can include talking to a trusted friend, family member, or therapist. Engage in creative outlets like art, writing, or music to express your emotions. 4. Psychological resilience. Develop psychological resilience by building a strong support network of friends and loved ones. Enhance problem-solving and coping skills to better manage life's challenges. Consider therapy or counseling to address emotional issues and learn effective strategies for managing stress. 5. Work-life balance. Maintain a healthy work-life balance to prevent the negative impact of chronic stress. Set boundaries, prioritize self-care, and take regular breaks from work. 6. Regular checkups. Schedule regular medical checkups to detect and manage any underlying medical conditions early. If you experience persistent physical symptoms, Seek prompt medical evaluation to rule out any potential medical causes. 7. Mind-body practices. Engage in mind-body practices like meditation, Tai Chi, or yoga, which can help improve emotional well-being and promote physical health. 8. Healthy communication. Foster open and healthy communication in your relationships to reduce interpersonal stressors. 9. Self-care. Prioritize self-care, which includes engaging in activities you enjoy and taking time for relaxation and leisure. 10. Psychoeducation. Learn about the mind-body connection and how emotional well-being can influence physical health. Understanding this relationship can help you become more aware of how your emotions affect your body. 11. Address past trauma or unresolved issues. If you have experienced past trauma or have unresolved emotional conflicts, consider seeking therapy or counseling to address and process these issues. It's important to recognize that psychosomatic disorders are not always preventable, and some factors contributing to these conditions may be beyond your control. However, by adopting a holistic approach to health and well-being that includes both physical and emotional self-care, you can reduce the risk of developing psychosomatic symptoms and promote overall health and resilience. If you do experience persistent physical symptoms or emotional distress, it's advisable to seek professional help and guidance.